Hello, my name is Gabriel Pardo, and today I'll be talking to you about breast cancer. Breast cancer is one of the leading causes of death for women in America, and though there has been some progress over the years, breast cancer continues to be a threatening disease to both men and women in our present time. To familiarize you with what breast cancer is, it is a malignant tumor that starts in the cells of the breast. A malignant tumor is a group of cancer cells that can grow surrounding tissues or spread to the distant areas of the body. First of all, I'd like to talk to you about breast cancer and men, because for some people they don't understand that men can also be affected by this disease. Recent studies show that 1,970 new cases of breast cancer will be diagnosed amongst men. An average of 390 men will die from breast cancer per year, in comparison to about 40,000 women who die from breast cancer a year. It is also shown that men are 100 times less likely to be diagnosed with breast cancer. For men, the risk factors are different than that from women. These vary from male to male depending on their inherited traits. The two main risk factors are hyperestrogenism, which is an abnormal production of high levels of estrogen in men. This can lead to them having large breasts. The other risk factor is Klinefelter syndrome. This is a risk factor for cancer in men, and this happens to only 1 in 1,000 people. This is a situation in which the men inherit 2 X chromosomes from the mother and only 1 Y chromosome from the father. In normal cases, a person will receive only 1 X chromosome and only 1 Y chromosome. These extra X chromosome would lead to very little body and facial hair, enlarged breasts, and small testicles. This would then increase the risk by up to 50 times. Some of the leading risk factors in general are basically the risk factors are basically defined as a variable associated with an increased risk of disease or infection. They vary from person to person, but here are a few that are important. Age. It is shown that as a woman ages, her chances of being diagnosed with breast cancer increases. Also, it is also shown that 2 out of 3 women with invasive breast cancer are over the age of 55. Gender, obviously, as I stated previously, it is shown that women are 100 times more likely to be diagnosed with breast cancer. Dense breast tissue, this is a risk factor because in this case, the woman has a higher concentration of gland tissue rather than fatty tissue, which is generally what breasts are composed of. This is an issue because doctors have problems spotting any difficulties on mammograms. Continuing with the risk factors, radiation. Women who've had radiation to a chest area have a higher risk of obtaining breast cancer. It is shown that women who've been treated in the early ages, such as the teenage years, are affected even more because during the time of the teenage years, the breasts are still developing, so it affects them more. Another risk factor is gene mutation. This is an interesting situation in which genes are altered. The most common gene mutations are of the BRCA1 and BRCA2 genes. These alterations of the genes increase the possibilities of obtaining breast cancer by up to 80%. Lobular carcinoma in situ, LCIS. This is a risk factor in which the milk-making glands, which are called the lobules, they're not a pre-cancer or a cancer, but it doesn't spread to the other part of the body, but it's a risk factor because it affects the glands in the breast. These increase the possibility of being diagnosed with breast cancer from 7 to 11 times. Some of the treatments, well, there are various ways that doctors can treat breast cancer. It is mostly a decision between medicine, surgery, or radiation therapy. But in most cases, doctors primarily go with surgery. There are 2 main forms of surgery: a lumpectomy, which is basically a surgery in which only the tumor and some surrounding tissues are removed, and that's basically the most common one. The other type of surgery is a mastectomy, which is a surgery in which the whole breast is actually removed. Another type of surgery is a cryotherapy. This is also called cryosurgery, and in this process they freeze the cells and try to kill the cells by using extreme cold. Another treatment that is used, which is one of the most used ones, is their drugs. There are over 45 drugs that I found throughout my research, which all basically do the same thing. They're aimed to either weaken or destroy the cancer cells, or also to block the effects of the estrogen into the breasts. Chemotherapy is another treatment which is used, and this is a process of using medicine that goes through the whole body to destroy or damage cancer cells. Sometimes doctors feel that it's necessary to use chemotherapy before surgery so that the cancer cells won't be as spread out, and it'll be easier to remove the cancer cells, such as a tumor or something like that in surgery. Another treatment is radiation therapy. This is a targeted therapy to the affected area that uses a special high energy beam to damage cancer cells. There are two forms of radiation therapy. Doctors can use a machine that beams the high energy beam from the outside of the body, or they also use pellets or seeds that give off radiation from within the body. Hormonal therapy is another treatment. It is a process in which medicines are used to lower the amount of estrogen or blocking the action of the estrogen on the cancer cells. Well, to talk about some of the side effects for the treatments. In surgery, some of the side effects might include wound infections, problems with healing of the wound, bleeding, or lymphedema, which is a blockage of lymph vessels that drain fluid from tissues throughout the body and allow immune cells to travel where they are needed. For chemotherapy, some of the side effects are diarrhea, fertility issues, hair changes, vomiting, neuropathy, and weight changes. These are just a few of the side effects. One of the side effects that I found was red blood cells are decreased, and they treat that by using a medicine called Epigen, and this increases the amount of red blood cells in the body. Some of the side effects for radiation therapy, well, the side effect is similar to a skin reaction to a sunburn. And in this case, the skin is affected like a sunburn. It becomes itchy and dry. And other side effects include armpit discomfort, chest pain, fatigue, heart problems, lung problems, and lowered white blood cell counts. Well, as I stated earlier, there are a lot of drugs that they use to treat breast cancer, but some of the main side effects for all the drugs are basically diarrhea, vomiting, swelling, infections, kidney damage, and nerve damage. Well, to finish up, I would like to go over my main points. Just be aware that men are also affected by this disease, even though there are somewhat different risk factors from women. Also, some of the risk factors in general are unchangeable. You're just born with and you just have to live with them. The main treatments for breast cancer are surgery, chemotherapy, hormonal therapy, radiation therapy, or medicine. And side effects vary depending on what type of treatment is used. So in the case of surgery, there'd be a different side effect from if you use medicine. At this point, I'll open up to any questions, if there are any. Yes, you have a question?
Yes, what's the cryotherapy?
Cryotherapy? Well, cryotherapy is actually a process in which they use extreme cold to free in the area that's affected, and it freezes the cancer cells. And in some situations, it also freezes some of the skin cells and other cells of the body. But it mostly aims to kill the cancer cells.
Okay, thanks.
Well, thank you for your time. You've been a great audience.